Welcome to the Golf Fitness Bomb Squad podcast with Chris Finn, a production of P4S Golf. Welcome to the Golf Fitness Bomb Squad. My name is Chris. I'm your host, and today we're going to be chatting about back pain, but not just any back pain. We're going to get real specific here. Over the next couple episodes, we're actually going to talk about how to differentiate what type of back pain you have, where it's coming from, and what to do to actually address it. So 98% of you listening, you don't actually have a bad back. You have bad movement in your hips or your spine or your in spine, I say usually thoracic spine. And so not your low back or your shoulders. You're doing something in your golf swing, some combination of all of those things that are causing your back to feel like it has a problem, but the actual problem is elsewhere. Now, your symptom of your back hurting is real, and that's where most people say, "Oh, I got a bad back." But so today we're going to talk specifically about the one-sided back pain. So if you get done playing, a lot of people, honestly, it's just like maybe it's sore after you play. You wake up the next morning, maybe it's okay. You can walk it off, warm up, and it feels better. But it's always just like this little twinge that can be there. I'm talking. This is for you, okay? Or if it's like debilitating, like this is for you too. So the way to find it, usually where it starts from, it's right around your belt line on the back. If you take your thumbs along your belt line and you kind of work them from your sides around to the back, you'll find these two little bony spots called your posterior superior iliac spine. So PSIS for all you fancy anatomy nerds out there. That's where a lot of it kind of will feel like it starts from. And then it will typically radiate down a leg. So, usually, and I say usually, this is probably only really a 60-40 spread. So usually for a right-handed player, it goes down your right side. For a left-handed player, it goes down your left side. So your trail leg. But there's probably 40% of you that experience it on the other. So there's a slight favoring towards the trail side. And reason being, there tends to be a lot more side bend towards the trail side because of the limitations that you have that tend to drive this issue. But it can also be on the lead side too. So just because you have it on the lead side, like this still all applies to you. So like almost half of you. So when you do get this issue, I think one of the challenges in terms of diagnostics is that sometimes it can feel like it radiates down your leg. So it can feel like it's going down into your hamstring. Some people feel it down the side of their leg, like their IT band or even their quad sometimes. Usually it's more middle to back. And then they'll feel it down in their calf. Unless you're feeling it down like into the foot and toes, that typically is a signal like, hey, that's a nerve, right? That's like your sciatic nerve is having issues, or one of the bigger nerves coming out of your spine is probably being impinged, and there's an issue down there. But if it's not going into your foot and it stops kind of ankle or higher, 98% of the time, that's not actually a nerve problem. It's usually just more so, it's more of a tissue problem. So you have trigger points that have developed in the musculature that can mimic kind of nerve-like sensations. So that's what makes diagnosis a lot of the times hard. And that's what makes a lot of people who come into that, I've got a bad sciatic nerve. I've had it for 5 years. No one can figure out how to fix it. I've had 2 surgeries. And you go in, it's like, well, dude, just because it's just a tissue issue and you've been addressing problems that maybe on imaging look bad. And this happens, unfortunately, more than I think the medical community would like to admit. But so much diagnosis is done from x-rays or MRIs. And you're like, oh, you got arthritis. And it seems to be right where the nerve comes out that has that L4, L5, pattern, down your leg. And so therefore, we're going to go in and operate because you did PT and PT didn't work. Nobody asks you, well, what'd you do in PT? Well, I just did exercises. I did bridges and clamshells. Like, did you do any tissue work? Well, no. Well, so if you don't do any tissue work, you're not going to fix the trigger points. Just doing exercises doesn't fix it. So unfortunately, a lot of bad PT doesn't do manual work, which doesn't address the tissue stuff. And you go through the 6 weeks of tissue, basically orthopedic lore, right? If you want surgery, you go to the ortho the first time. They're going to give you Advil, send you to PT. You go do PT. Let's say it's bad PT, which unfortunately happens more than we'd like to admit. As a physio myself, I'd rather not admit how often it happens, but it does. They just throw you with exercises with the assistant or the aide, and the PT just evaluates you every 30 days because that's what they need to do in order to get paid by insurance. And you go back to the doctor and they're like, how's it going? And you're like, it's not any better, right? Because nobody's done any manual work on you to get rid of the freaking trigger points. So then, and they've also done imaging and they say, oh, you have arthritis, or, it could be impinging on the nerve coming down that side, and where you're feeling the discomfort matches where that nerve, innervates. So you go the second time, they give you a shot. So first time they'll give you, anti-inflammatories and tell you to go to PT. Second time you go, they're going to tell you to get a shot. They give you a shot of steroids, and magically maybe it gets a little better for, a week or two, and then all of a sudden it's back. Shocker, because we didn't actually fix the dang problem. So you go the third time, then they'll cut you, right? Then you can get surgery. So you just got to go to the ortho 3 times and they give you surgery. And this obviously is not good orthos. This doesn't happen with good PT. This is unfortunately the puppy mill of orthopedics and physical therapy that has unfortunately evolved out of the insurance world, where we diagnose mostly off of imaging. And if we go to shitty PT, it doesn't work, then we go ahead and we inject. Magically that doesn't work, so then we cut, right? And then you get these people that have gone 4 or 5 years, had a couple surgeries, and it's still lingering, and they just think, I just got to live with it. Long-winded way of saying, if you understand the etiology of where this stuff comes from, you can take the simple solution first, which is, hey, it doesn't go all the way down to my foot. I have it on one side. Typically, there's trigger points that are presented in the glute muscles, particularly the gluteus medius and minimus. So those are the little glute muscles kind of on the side of your butt, not your big butt cheek. That's your gluteus maximus. So a little more to the side, so going towards kind of the side of your hip. And remember we talked earlier about the belt line. So think of in your butt, like go a little to the side of your butt, from that belt line down, from that little bony spot down. It's going to feel almost like you're laying on your side. Put a lacrosse ball in there. Put a softball in there, right? If you don't want to pay for physio, like you literally go to our YouTube channel, Par for Success. Like there's tons of videos on there, how to roll, lacrosse ball or glute med roll, or use a ball, something that has isn't broad like a foam roller, so that it can actually dig in there, and lay on your side, and it will probably make you come up with some new 4-letter words. And that's how I always joke. I said, if you want to make sure you're in the right spot, see how many new 4-letter words you come up with. And if you're coming up with 4-letter words, you're sweating, just laying on a ball on your side, you're probably on the trigger point that hurts like hell. And so unfortunately, this is one instance where no pain, no gain applies. And if you can lay on it and it twitches and eventually the pain will dissipate after a couple of minutes, that alleviates the pain. And that, the way I use the analogy, that little bony spot we talked about in the beginning of today, kind of on that little bony spot on your back, you have one on either side by that belt line. Think of that as an anchor point of your glute muscle, of what your glute med. And then consider there's another anchor point down in the side of your hip, down like on your femur, right? And think of it as a tug of war. And if we have a trigger point, it's basically like let's consider there's a piece of spaghetti between those 2 points. We take a fork and we twirl that spaghetti, right? Either end is going to get tensioned, right? Where that spaghetti is attached to. And so unfortunately what happens when we get trigger points, we get these unwanted tensions in this tissue. And when you put a lacrosse ball or a softball on it, all of a sudden that tension releases. And it hurts when it releases, but then it feels miraculously like, boom, pain's better, okay? So if you do have pain on one side, I would implore you, go to YouTube, check it out, and just glute med release with a softball or with a lacrosse ball or with a baseball. We have them obviously at Par for Success, but you can get them. They're all over the place on the internet. Check it out and try it and see if that alleviates your discomfort, right? And that is going to be the first step to fixing your symptom. That doesn't fix your problem. Let's be very clear. That's going to fix your symptom, which gets rid of the pain. Now, if that's all you ever do, you will continually have to redo that release and redo that release and redo that release, because you're not actually going to fix the problem. The next question we need to ask ourselves is, why did that occur? And usually it's because we don't have good hip internal rotation, or we don't have good shoulder rotation, or we don't rotate somewhere well in our golf swing. And honestly, this is probably one of the more common back issues we see in non-golfers as well. So basically, bad hip movement is not exclusive to golfers. It's most of the population. Just so happens with golf, we need a lot of rotation, so we tend to be more aware of our lack of it. But if you can improve the movement of that hip and get that hip moving with better mobility, and then you get it stronger, so there's specific strengthening exercises. And no, clamshells with TheraBands are not going to do the answer. Sideways walking with TheraBands, and that's all you do, because Lord help me if I see another freaking physio doing that with their patients, and that's all they do. Just bunches of band, like that doesn't build enough load on the tissue to cause a physiological adaptation long term. So you need to get more mobile. You need to get stronger. And then you probably, as long as you're active, doing the tissue work as kind of a maintenance, a couple times a week just to keep the tissue healthy is one of the keys to longevity. So hopefully you found this helpful. I tried not to go too deep and get too nerdy on this with you, but I did want to make sure to explain it to a degree that it was hopefully understandable in terms of why it's happening. So if you're getting, just to recap, you have back pain on one side, so just the right or just the left. It feels like it comes from that little knob on the belt line. You got one on each side called the PSIS, or the posterior superior iliac spine. So you can sound really smart at your next party with your buddies. Typically, it will radiate down the leg. If it's bad, it'll radiate down into your hamstring or even to your calf in really bad cases. That's a normal referral pattern. If it's not going to your foot, it's probably not a nerve. Sometimes it is, like 2%. But majority of people listening, you can probably resolve it's probably a trigger point. That's the more common by far of the two. Go after it with a softball. That's going to be the bigger one, the most effective. If you can tolerate the softball, would be to go to a lacrosse ball or a baseball. Those are smaller. Those will dig a little bit deeper. Look it up. A glute med, GLUTE-MED. If you want to use the full term, the gluteus medius, MEDIUS release. Look it on YouTube. We have them all at Par for Success on our page. We explain all this to you there as well. And see if you can release it. It's probably going to hurt. If it hurts, that means you're in the right spot. If it doesn't hurt, it means you're in the wrong spot or the tissue's totally fine. Rare that we ever find people with back issues where their glutes are totally fine. But go in there, see if you can release it. That releases the tension in the muscle, which then really gets rid of the symptomatic pain that you're having and that tightness and the tweaks. And then the key to long-term fixing it is keeping it mobile, making sure you have good internal and external rotation of the hip, and then obviously getting that hip stronger by actually loading it with, I think, squat-like patterns, hinge-like patterns, like a deadlift type pattern, kettlebell swing type pattern, lunges, those sorts of things, with actual load. So hopefully you found that helpful today. Hopefully we diffused a few of you who are battling some back issues. Stay tuned because the next episode, at least one more episode, we're talking about a couple of the other types of back pain that people deal with and help you to identify those. But this is definitely, if you have one-sided back pain, this is definitely the go-to fix to start out with. And if you have any questions, as always, feel free to reach out and we'll be happy to guide you in the right direction. Thanks a lot, and we'll catch you on the next episode.